Hey guys, this is Logan. This is my video for the Module 3 blog. So looking at the first question, the skills for obtaining resources, especially looking at staff. Some of the ones that I think I possess or that I think would be important in a manager, look, they're a lot under the directing aspect. One of those is supervising, and it lists out that some of the important qualities for supervising: offering praises for your employees when they do a good job, being a very active listener, listening to their problems or any concerns that they have, remaining cool, calm, and collected during most situations. You gain respect through your honesty and working on the problems and concerns of your employees. You're very fair, you're approachable, friendly. Motivation and good communication skills are also very important, and I think I'm definitely improving on those as I further my nursing career. These skills, I think, not only help gain resources like employees, but I think they're very important in employee retention. It's very important, especially saving money for a hospital, to keep your employees, as the cost of hiring new ones and training them are going to be much more expensive than keeping the ones that you have. Doing the leadership questionnaire, I scored a high in the interpersonal part. I wasn't too surprised about this. Working with my coworkers, I think I do a fairly good job. Kind of knowing their personalities, knowing what kind of follower and or leader they are. You know, which approach for me to use when I'm having to be team leader, making assignments and divvying out who's getting what patient, who's getting this admission, who's getting that admission. I'm definitely getting better about knowing how to approach them about those things in a way that they're not going to take it as I'm just telling them what they're going to do, no questions asked. So I definitely think that was pretty on the spot and accurate for me. I was in the moderate range for the conceptual and administrative part. I was actually a little surprised. I thought I'd probably score a little bit lower than just the moderate range in those when I went back and looked at the questions. So I think I was actually more well-rounded than what I initially thought about myself. Looking for the article, I found one on doing a transdisciplinary model of care in the acute setting with palliative care. Palliative care is something I'm very interested in, so I found the article very interesting and I enjoyed reading it. So it looks at taking a group of people, making a transdisciplinary team: nurses, physicians, social workers, pharmacists, pastoral care, to all work together for these patients. The article looked to identify the different roles of the transdisciplinary team and what each role of each person needed to be. It looked to define a palliative care model, identify the needs of the patients, their families, and develop palliative care tools. As medicine has improved over the years, it has led to an increased survival rate. People are living longer, but because of these, people are also living with not just one, but multiple, sometimes 2, 3, and 4 comorbidities, which can really impact the quality of care of their life. And palliative care looks to help patients have the best quality of life that they can with these comorbidities. So it said that palliative care is a holistic approach to chronic illnesses. It's there to help prevent suffering and relieve suffering so that patients and their families can have the best quality of life. From this article, after they had implemented this care team for a year, it showed that there was an increase in patient care integration. All members of the team communicated about the patient. Their needs were assessed much earlier in their hospitalization, and so those needs were met more quickly. All the team members expressed an increase in their job satisfaction, and patients reported that they felt less alone during their hospitalization, as well as more of their psychological needs were met during their stays. So, looking at the levels and departments in an organization, the ones that I work with the most in my job, obviously I work very closely with the cardiologist and the hospitalists that work there, but I also work very closely with physical therapy and discharge planning. Those are probably the two I work with the most. A lot of our patients come from less privileged backgrounds. A lot of them have trouble affording their medications. So we work with our discharge planners to see what medicines can we fill for them at the hospital before they go so they have a month's supply. What programs can we enroll them in to help them afford their medicines, and find out which medicines they need and which are equivalent at a lower price or which can be generic. We also work with a lot of the dietitians and cardiac rehab for these patients when they head out of here or out of the hospital. We help them to learn about a healthy diet, and then the cardiac rehab comes in and explains to them how to get their heart back in the best shape that it can be after their hospitalization. Looking at the organization structure, First Health is a pretty big organization, at least in my area. Not only does it encompass the hospital, but there's primary care providers. There are specialty doctors as well as diagnostics. Working in the hospital, I feel that we have a more horizontal structure or horizontal differentiation. Inside the hospital, we are broken up into multiple different departments that all work together with different tasks and different skills. We have nursing, we have the physicians, physical therapy, occupational therapy, dietary, the case managers, social workers. We have lab, we have our outpatient section, our surgeries, our diagnostic departments, and all of these departments have their own staff, their own managers who then report to their higher ups and so forth until we get to the director of the hospital. I do feel like I like the horizontal structure. I like the fact that it is less formal in nature, but you still have your managers and your guidance and your authoritative figures. But as an employee, we also have a little bit more freedom. So that's it for my blog. I look forward to watching you guys' videos and replying. Have a good evening.